play the music, and then once it fades out, you're live.
Okay. Hello, everyone. How are we doing? I want to welcome you back to Dr. Gilead Show. I am your host, Dr. Theo Oswala. Today is Thursday, February 22nd, 2018. February 22nd, 2018, and you are back on Dr. Gilead Show. We are on Facebook Live. We are also on WBGR Radio here in Lanham. So you can send us a message on Facebook Live or tweet, or you can also call us if you are in the area. You can call on WBGR Radio on 301 429 9247, 301 429 9247 on WBGR Radio. Today, we're talking about a very, very sensitive topic called kleptomania. Kleptomania. But before we start, we usually say, please do not use what you hear on this platform to make a diagnosis of yourself or of someone else. It's always good to get the appropriate diagnosis from trained personnel. Dr. Gilead Show, the producers, our guests, and our hosts cannot be held responsible for what anyone does based on what they hear on this platform. So it's always good to please get the appropriate evaluation, get the appropriate diagnosis, and be treated by a trained professional. Today we're talking about kleptomania. And some people have asked me, what is kleptomania? They come to my office, they talk about one topic or the other. But the thing is this. One thing we all know is that kleptomania is recurrent, very recurrent inability and failure to resist the urge to steal items that are generally of no monetary value, items that you really don't need, items that have very little monetary value. So kleptomania is that inability or failure to resist the impulse. So these people, they have the impulse to steal and steal and steal. They just want to take. They for no reason. The thing they are stealing is completely of no value to them. They may afford it 100 times, but they just get a kick out of stealing it. And it's not for any reason. It's not for monetary purposes, but they just cannot resist the impulse to steal. So this diagnosis is a type of poor impulse control. It's really a type of very poor impulse control, and it causes a difficulty with emotional or behavioral problems. So they have emotional and behavioral poor self-control. Generally, people with poor impulse control have difficulty resisting temptation to do too many things, and this is just one of them. They may do it excessively, and even though it may be harmful to them or to other people, they just cannot resist that impulse. That is what we're talking about today. Kleptomania, difficulty resisting the impulse to steal, to take what does not belong to you. People with kleptomania, they live a life of shame because of what they do. There may be people seen in society as people with impeccable character, high integrity people, people will say, well, this person is a high level positioned person in the society. They have an impeccable character, but they have this difficulty to resist the impulse to steal. That is kleptomania. And it doesn't matter. It doesn't matter what, wherever they are or who they are, they do this without, with very difficult, big time difficulty controlling this impulse. and it haunts them. They feel ashamed about it, but it's a struggle. They cannot help themselves. Now, what could be the now is I just want to say this, that in kleptomania is they resist the impulse, but there is no, they don't plan it. They don't set out to say, okay, I'm going to go steal. No, but they just find themselves in a place where they find something, and that impulse comes to take, and they take it, they struggle with it, they get a kick out of it, they want to take it, and you see them struggle, but still they take it. What could be the cause? Why would someone steal and steal and steal? And even though they may get in trouble, they still don't care. They struggle with it. They they struggle with it. They go to very, very big time level trying to get it. Why would anybody do that? Even though they know they can get in trouble. But they just have that incessant feeling, the drive to take what does not belong to them. They are ill. It is a sickness. It is a problem to them. But the cause is not known. Now, but there have been a lot of theories which suggest that there might be some problem with the brain. It might be linked to some changes in the brain, which could be chemical, and what we call neurotransmitters, like I always call them. So they may have a neurotransmitter problem. So the brain is not functioning the way it should function normally. It's been known that transmitters or chemicals like serotonin, if there's a problem with the regulation of serotonin, with the mood and emotions, people could have this problem. So low levels of serotonin has been found in people that have impulsive behavior, people who have poor impulse control, difficulty controlling their emotions. It's been shown that the serotonin has been found to be low. Also, another theory is people who have addictive disorders. That means by nature they are addicted to doing things. So they get some kick out of it. Also, stealing may cause the release of dopamine. That is, the stealing they do may cause the release of dopamine. Dopamine is another neurotransmitter or chemical, but we know that dopamine is the chemical, it's the neurotransmitter that gives us a pleasurable feeling. Oh, they feel good, they feel wonderful, they feel real good. So this is when dopamine is high. They have this feeling of happiness, this rewarding feeling, and they want to have that feel again and again. They want to do it several times. They feel good about it. Also, brain opioid system has been implicated in this. So that means this urge to take, the urge to steal, is regulated by brain's opioid system. So an imbalance in this system of opioid in the brain makes it harder for them to resist the urge to steal. So these are all postulates, these are all theories, but we know that a lot of people go through such struggles. They don't want to take it, they don't want to take what does not belong to them, but they struggle and they find themselves doing it. And when they finish, they feel so ashamed of themselves. Now, what are the risk factors? What are the things that could make somebody, predispose somebody to being a kleptomaniac? Now, we know that kleptomania, the inability to resist the impulse to take what does not belong to you is a very uncommon disease. However, because of that, some people with kleptomania may never seek treatment, or they are put in jail after repeated thefts. So what happens they keep doing it off and on. They are caught, so they are put in jail. So some, because of this shame and behavior and uncommon nature of the illness, some cases of kleptomania may never be diagnosed. Usually kleptomania begins in early teens to early adulthood or young adulthood, but it can also start in adulthood or much later in life. The risk factors for kleptomania could be one, family history. So if you come from a family where someone is used to taking what does not belong to them, even though they may have a house full of it, they still go take it. There are chances that other first-degree relatives of that person may have a similar problem. So having a first-degree relative with or a sibling with kleptomania or other impulse control behaviors like obsessive compulsive disorder and alcohol or substance abuse disorder may increase the risk of kleptomania in somebody. That is one, family history. Now also it's been known that having other mental health care issues may also be a pointer that some people with such mental illness may also have kleptomania, and things like major depressive disorder, bipolar disorder, as well as anxiety disorder, or even some eating disorder may predispose people to having kleptomania. How common is kleptomania? Very, very uncommon. But we know that among people who have been arrested for shoplifting, those who have been arrested for shoplifting, 4% to 24% of them have kleptomania. And that means they do shoplifting, they go to the store, they shoplift, they are caught, they're punished, they cannot resist the impulse, they go back and they keep stealing what does not belong to them, kleptomania. So they keep stealing and stealing. So the prevalence among people arrested for shoplifting is very high, 4% to 24%. That is not unexpected. But in the general population, it's very rare. We have 0.3% to 0.8% of our general population may have kleptomania. One thing that we must know is that kleptomania is more common in women. About 2/3, 2/3 of all people who have kleptomania are women, and the ratio is 3 women to 1 man. For what reason we don't know, but we know that obsessive compulsive disorder and other poor impulse control disorders may be higher in women, but specifically kleptomania is more common in females than in males, 3-to-1 ratio. So the question is this: what are the symptoms of kleptomania? What are the symptoms of kleptomania that we know? And the symptoms are from our Bible of Psychiatry, which is the Diagnostic and Statistical Manual of Mental Illness, which was designed by American Psychiatric Association. There are 5 criteria, and if they meet these criteria, they are diagnosed with kleptomania. So for us to make a diagnosis of kleptomania, we look at the criteria as stated in DSM-5, the Diagnostic and Statistical Manual of Mental Illness. Now, what are the symptoms? Number one symptom is failure or inability to resist impulses or powerful urges to steal objects that are of no relevance, objects that are of no use, objects that are of no monetary value. People, number one, they have this recurrent urge, recurrent impulse to steal these objects that are of no use to anybody, even to them. They may have millions of dollars, but they go to the store and steal an underwear. We know a classical world mother, I'm not going to mention names, who we know used to go to the stores and steal underwears, that her orderlies, her uh, assistants will walk behind her. Whatever she steals and puts in her purse, they will go and pay. That will tell you how bad it is. This is the mother of a millionaire, a world acclaimed millionaire, a world known figure, the mother. And yet, she goes to the store to steal underwears. Kleptomania is classical. So the first criteria is recurrent failure or inability to resist this impulse to steal things that are of no monetary value, things that they don't need. They don't need it. That's number one. Number two symptom is they have increased tension. They have some tension. They feel this tension inside them. They have anxiety as well immediately before committing the stealing or before committing the theft. So they see something, they walk into a store and they look at something, woo, they feel this tension build up inside them. It builds up, and they feel like they're going to explode. They have anxiety, they feel nervous just before carrying out the stealing act. That is number two symptom. So they can't resist the impulse, number one. Two, they have this tension, increased urge in them to do it, number two. And number three, once they do it, they have this sense of feeling of pleasure. They have a feeling of gratification. They feel fulfilled, or they feel this relief from that tension which was building up before carrying out the stealing or the theft. So number one, they get the impulse to do it. Number two, they feel the tension inside them, the strong urge, they feel anxious. Then number three, they carry out the act, they feel good. They feel this gratification. They feel happy that they've done what they've been waiting to do. So they have this sense of fulfillment. Now, also number four, the stealing is not committed to express any anger. It's not done to punish somebody. It's not done as a vengeance. And it is not in response to a delusion or voices. We know that some people may hear voices to say, oh, go do this or go do that. That's not what this is about. They have this tense feeling, and when they do it, they feel good, they feel happy. I've been able to achieve it. They feel this gratification. But it is not following a psychotic symptom. It's not like they're hearing voices or they're seeing things asking them to go do it. Number five, they feel guilty. Can you imagine? They feel guilty, they feel remorse, they are so ashamed, and also they are very afraid of being arrested after they've done the stealing, after the theft. So why would anybody do this? Something must be wrong. Kleptomania. So when they feel happy about doing it, then once the rush is over, they feel so ashamed. They feel guilty. And they feel very remorseful. But also they are afraid that, hey man, I'm going to get arrested. But what happens? They still go back and do it again and again and again. And they cannot resist the impulse. That is a sickness. That is an illness. It is not normal. Now, another symptom is the urge to steal, the urge to do the theft returns, and it repeats itself, and it continues. It's a cycle. It's a cycle. They walk into a store, they see the thing, they feel the impulse, they feel the urge, they do it, and they feel ashamed, they feel remorseful, and the next time they go again. They go again, and they keep doing it. It becomes a cycle. They do it all the time. So the question is, what are the features of kleptomania? What are the things a person with kleptomania we typically exhibit. What are the characteristics? Now, unlike the typical shoplifter who probably his 2-year-old son doesn't, or she or he doesn't have money to buy his 2 or 3-year-old a winter coat, and they go to the store, they look for a little baby's coat, and they take it, they put it in their clothes or in their purse. That is completely different. People with kleptomania, they don't compulsively steal for personal gain. No, they don't need it. What they are taking is not what they need. They're not taking it because, oh, their son needs something and they cannot afford it. No. There's no gain in it. They steal simply because the urge is so powerful and they cannot resist it. That drive is so strong, they cannot stop themselves. They know it's wrong. They know they could be caught. They know they could get in trouble, but yet the urge is so powerful. It takes them over completely, and they do it. And once they do it and they are not caught, they feel good. Even if whether they are caught or not, they feel good and happy that they've been able to carry out one of those escapades. It gives them some sense of fulfillment, and so they have a feeling of reward in them once they do it. So it's not like the regular shoplifter. No. Number two, a characteristic. The stealing generally occurs spontaneously. It's not like they plan from their house. Okay, I'm gonna go to Macy's this morning. I'm gonna look for a beautiful shirt, and I'm gonna steal it. Or I want to buy perfume for my husband or for my wife, but I can't afford it. So I'm going to go into Macy's. I'm going to look for the best perfume, and I'm going to buy it. No, that's not it. They don't plan it. They go into a store, probably to do a little grocery. Then, boom, the urge fills up. It builds up in them. Without planning, without help, or without collaboration from somebody else, they go ahead and do it because they cannot resist the urge or the impulse to steal. Now, one thing I want you to look at this. They avoid the stealing when there are chances of getting arrested. Like if they know that there's a policeman in the store, they will not do it. They will try and hold themselves. They will try and restrain themselves. So they avoid the stealing when there are chances that they could be caught. That is one very important feature of kleptomania. So they do everything so that they don't get caught. Now, most people with kleptomania steal from public places. And it's not only public places, they steal in stores, they may also steal in supermarkets, they may even steal from friends and families. They may steal from acquaintances. They may go to a party and they look at what is there, they steal something. So you're hosting some people for a party and they walk into your house, everybody's enjoying, eating and drinking, and boom, somebody's looking around, he or she sees an antique little thing, and boom, they take it, they put it, they look at it, the tension builds up, the urge to steal builds up in them, and they take it. And they feel good. They feel that relief. That is kleptomania. The difficulty, the inability to resist the impulse to steal, to take what does not belong to you. Kleptomania. And they do it over and over and over continuously without stopping. Now, also, it's worthy to note that often what is stolen have no value to the person. So the person with kleptomania may be actually a multi-millionaire, may have so much money, may have so many underwears or stockings at home, but yet they get into a store, they steal underwear or they steal stockings, things that have no value, things that they can afford 1,000,000 times, but yet the urge, the impulse to steal fills them so bad that they go and they take it. That is classical of kleptomania. Now, occasionally the stolen items are hoarded. They're never used. They're never given to anybody sometimes, but they just pile it up somewhere. They hide it. Sometimes they may donate it, or other times they may sneak back into the store to return it. They may give it away to family members. So sometimes they just arrange it in their houses. They may give it out, or they may quietly or secretly return them to the place where they got them from. That is that is unbelievable. That is unthinkable. They steal something they don't need, things they can afford, things they can quietly pay for because they are so rich. But yet, they go and steal it, and they don't have any use for it. At the end of the day, they may find a way to return it quietly. Also, the urge to steal may come and go. It may occur with greater or lesser intensity with time. So sometimes the urge, the intensity may be higher, other times the intensity may be low. And most times they attempt to resist the impulse to steal, but they cannot. It completely overwhelms them. Also, they know, they are completely aware that this behavior is wrong and it is senseless. So why do they do it? I tell you what, something is wrong with that brain. Something is not right with that brain, and that is why they do it. So they can't stop it. They would love to. They would love to stop it, but they cannot because something is wrong with their brain. That is kleptomania. Also, they fear being caught. And at the end of the day, they feel depressed, they feel sad, they feel guilty, they feel very remorseful. Why am I doing this? They go into their closet and they put their head down and cry and say, oh my God, why am I still in this? I could be caught. I'm a man that people look at with such an impeccable character. They think that I'm a good man, but I don't need these things. I have so much money. I could have paid for it. I have $1,000 in my pocket. Why am I still in it? That is kleptomania. That's one of the features of kleptomania. So they struggle, they don't want to do it, but at the end of the day, they do it because the urge to do it is completely, totally irresistible. They cannot help themselves. And because they cannot help themselves, they do it, and when they do it, they have a relief. But what happens, at the end of the day, they feel so guilty. They feel so ashamed of themselves. They feel very remorseful, and they can just go hide it in their house, or they can give it out to people. Or sometimes they surreptitiously sneak back into the store and return it, or return it to wherever they got it from. But the question is, for a person to be doing this, they must be sick. No normal thinking person will go to a store and see what they have, what they can afford, and steal it. That is kleptomania. And we know that is not uncommon. Is something that happens, it's not very common, I'm sorry, but it's something that happens with people. So if you're just joining us, we're talking about kleptomania today. And on Dr. Gilead Show, we are on WBGR Radio. We are also on Facebook Live. You can send us a question. We're going to take a little break, but before we go, I just want to recognize a few friends who have joined. Joseph, Abba, Ernestine, Thomas, Prince Will. Okay, these are people from all over the world. Thank you very much for joining. We are, and there are many others who are viewing on our platform. Thank you for joining. We're talking about kleptomania, which is that impulsive urge to steal that is irresistible. Don't go away. We'll take a short break and we'll be back shortly, and we'll continue on the topic of kleptomania. Don't go away. Hang in there.
So I forgot to tell you, new thing. The commercial's playing. You're not seeing. See that camera right here?
Mm.
It's green. When it turns back red, you're live. Okay, so it's not being seen right now. I heard. When it turns red, you're live. Yeah. So you got about. It was a 2-minute commercial, so you got probably about a minute.
All right, ladies and gentlemen, welcome back to Dr. Gilead Show. Thank you for staying on. Today we're talking about kleptomania. Kleptomania is our topic today, which is the incessant urge to steal, to take what does not belong to you, kleptomania. And it's not very common, but it's known to be very, very common in females and also in people who do shoplifting. But this is not for any gain, it's not for any purpose. So kleptomania is our topic today. Welcome back to Dr. Gilead Show. We are on Facebook Live. We are also on WBGR Radio. You can call on 301-429-9247, 301-429-9247. Thank you for joining back. I want to say thank you to Paddock Healthcare Pharmacy, our sponsor, for helping us to keep this program on the air. Thank you, Paddock Healthcare Pharmacy. It's a family-owned pharmacy on Annapolis Road here in Maryland, Bladensburg. All right, we've talked about symptoms of kleptomania. Let's look at the complications. What are the things that could happen if kleptomania is not treated? If someone has kleptomania and is not treated, it can result in severe emotional problem, severe work problem, family problem, legal and financial problems. Because what is going on here is they are taking what does not belong to them. They are stealing. They are stealing. For example, we know stealing is wrong, but they completely feel very, very powerless to resist the impulse. So they are always wrecked by the guilt, the shame, the self-loathing and humiliation they go through within themselves. They feel so bad, but yet they cannot help themselves. So they go through severe emotional problem. Now, too, they could also be caught. In every store, in every departmental store, we have cameras everywhere. So they could be caught. And you can imagine a man seen with such an impeccable character caught on camera stealing underwear. And he has in his pocket $1,000. He gets arrested. The news carries it. It is such a problem for that person. They could get arrested, they could get locked up, they could go to jail. So it brings a lot of legal issues, and that could completely disrupt the family dynamics. You can imagine learning that your husband has been stealing underwear from a departmental store. That will kill that family. That will completely break that spouse. That is, and of course, they could go to jail, legal problems and all that. It can also bring so much embarrassment to the family. It could bring so much embarrassment to the family. You can imagine the mother that I talked about, who we all have heard about. As she goes, she steals things, puts in her purse, but her assistants will walk through and go pay for them because they know she has this irresistible impulse to steal. That is kleptomania. That is a big complication. Family embarrassment, embarrasses friends, embarrasses family members. So those are some of the complications. Now, and people have really committed suicide because they feel so ashamed of what they are doing, of what they've done, and they feel very bad. So that is one of the main complications of kleptomania. So how do you make a diagnosis of kleptomania? How do you diagnose kleptomania? Usually, as physicians, there are two things we do. We do both physical exam, physical evaluation, as well as psychological evaluation. The two are done to make sure that every possible cause of this change in behavior is found and appropriately treated. Now, physical evaluation can determine if there may be any medical reason that someone may be acting that way. Any reason, anything that triggers this impulse to steal. And this could happen if someone has a traumatic brain injury, because you have somebody who has been behaving well, acting right, no problem, and suddenly after a motor vehicle accident or a sports accident or a fall, they hit their head, then they begin to do things completely out of character for such a person. So you have to get a good history, do a physical exam, and possibly get an MRI of the brain to make sure that that brain is not traumatized. Once the physical exam is done, the next thing is to do a psychological evaluation. This is done by a psychiatrist or a therapist or a psychologist or mental health care provider. Now, kleptomania is diagnosed based on the criteria and symptoms as listed in the DSM-5. DSM-5, that is the Diagnostic and Statistical Manual of Mental Health, as published by the American Psychiatric Association. Now, the doctor is going to target a few things. He's going to ask questions about your impulses. So if someone comes to me after a physical exam, what I'll do is go straight and ask questions about impulses, how difficult it is to control such impulses, how difficult it is to say no to doing things that are out of character for that person, to say no to stealing, to say no to taking things that don't belong to that person. So once you ask those questions, you also review a list of situations where this person may have done that, and what are the triggers? What are the things that make him do that? What are the triggers for the kleptomania episodes? And also, sometimes we use questionnaires, a psychological questionnaire or a self-assessment questionnaire, and we hand it over to the patient, and they score it. They look at it and they say yes or no, and if need be, write some things. That will all put together. If they meet the symptom criteria as listed in the Diagnostic and Statistical Manual of Mental Health, they're then diagnosed with kleptomania. Now, once someone is diagnosed with kleptomania, then what? What is the treatment? How do you help this person with kleptomania? Now, although fear, humiliation, or embarrassment may make it hard for people to come for treatment, it's hard for people to seek treatment because they don't know how someone is going to look at them. So most times people shy away from treatment. But I say this, if you're going through any of these symptoms, any of these things I talked about, I really will encourage you to go get some help. It is important to go get help. Looking at the complications we talked about, you don't want to get any of those complications. You don't want to get any of those problems. You don't want to go to jail. You don't want to be embarrassed or embarrass your family. So it's good to go get help. That is very important. Now, kleptomania is difficult to overcome on your own. So if you want to handle it by yourself, it is hard. And people with kleptomania will tell you, I don't want to do it. It's embarrassing. It's a shame. I feel so guilty after doing it. But yet, they go back to do it. How come? So it's very difficult to get help or to take care of it on your own. So go ahead and get help. Without treatment, kleptomania will continue to recur. They'll continue to go to stores, they steal things. They can't stop it. They cannot help themselves. And it will become a long-term condition. So it's better to go get help because help is out there. Now, there are ways of treating it. One is medication. Medications can help regulate the neurotransmitters or the chemicals in the brain. that when they are low, someone will have poor impulse control. That's one. Also, two, psychotherapy, which is talk therapy. Talk therapy has been shown to be helpful. Number three, which is the best, is a combination of medication and therapy. Also, number four, people have gotten help from groups, self-help groups. These self-help groups help the individual to see how other people were able to manage their own symptoms, how other people were able to get help, and that they can apply it to themselves. Medication, psychotherapy, a combination of medication and psychotherapy, as well as self-help groups. Let's take it one after the other. Medications. There are no approved, FDA approved medications for treatment of kleptomania. There are no classical medications that we say, oh, this is what is approved for kleptomania. No. Now, but what happens is your doctor can prescribe different medications to help you manage the impulses, manage the poor impulse control, manage the difficulty, struggle to resist the impulse to steal. So there are some medications that can be used, and that will be appropriately prescribed by the physician who is seeing you. Also, we've known that there are some medications that help with addiction. So this medication will reduce the urge or the pleasure associated with stealing. And actually, we use this in people who have opiate dependence, opiate use disorder, and it's called naltrexone. Naltrexone has been shown to be very beneficial to some people to prevent the urge to go and steal or take what does not belong to them. Also, we use serotonin specific specific reuptake inhibitors. These are medications that are used to treat depression, and they've been shown to be very, very helpful in people with kleptomania. The other treatment is psychotherapy, which is talk therapy. So the question is, what are the things that you would tell a patient? How will the therapist treat this patient with psychotherapy? The main therapy or the main therapeutic procedure that is used is cognitive behavioral therapy. In cognitive behavioral therapy, it helps the individual identify unhealthy negative behaviors, unhealthy negative behaviors or beliefs. With this, the patient knows that this is not true. Then they are taught to replace those unhealthy thoughts and behaviors with positive ones. That is cognitive behavioral therapy. So, the therapist opens it up to them to see the unhealthy behavior, to see the negative beliefs or the things that they are doing that don't make sense, even though they know that it's not the right thing, but they can't help themselves. But once they have a trained person, a third person come into their life and try to educate them on why this doesn't need to happen, or on why they're having these symptoms, and they understand it, then the negative symptoms are replaced by the positive symptoms, and it has shown to work. Other procedures that have been used are covert sensitization, in which people picture themselves as stealing, then facing negative consequences, such as being caught. So the person is taught to, when you have the urge to steal, stand there, close your eyes, and shake your head and say, look at yourself stealing, and look at yourself, you of great character. look at what you're taking and imagine that you're being caught by other people. Imagine that other people are seeing you, and then you look at the consequences. What will happen if finally I get arrested? That covert sensitization will help you avoid taking the thing. It helps you manage the impulses, even though it is difficult, but it's doable. The other type of therapy is aversion therapy. And this is a therapy that individual practices by himself. So they are thought to practice mindful, painful techniques. So they look at, they envision some mild, painful techniques, and they can hold their breath. They hold their breath until it feels like they are dying or they are choking, until they feel very uncomfortable when they get an urge to steal. So once they have this urge to steal, they can hold onto their nostrils, they can hold their breath, and that will help them wind down, and they don't steal. So once they continue to do it several times over and over, they will cut it out. They will not take anything that does not belong to them anymore. Now, there is also what is called systematic desensitization. Systematic desensitization is a process in which they go into the store, and when the urge to steal comes, they practice a relaxation technique, and they avoid stealing. They avoid taking what does not belong to them, and they leave the store, and quickly and gradually, if they do it several times over and over, that instinct, that urge would diminish, if not completely go away. So that is systematic desensitization. So they systematically go into the store, and they won't do it, they desensitize themselves. That means that they don't obey the call, obey the thoughts, obey the urges to steal something. That is key for anyone who has this problem of kleptomania. Now, what do you do to avoid relapses? Let's assume that you have been treated with medications as well as therapy. What do you do to avoid relapses? It's not unusual to have relapses of kleptomania. It happens, and it has a higher chances of happening. Now, to help you avoid relapses, you must stick to your treatment plan. You must stick to what treatment goals and how to achieve it that your therapist or your psychiatrist has taught you to do. Now, if you feel the urge to steal, you need to contact your mental health care professional, or also to reach out to a possible person or the support group. That's why you're supposed to go to groups. Once you get there, you can get a person, a coach, and you can always call them when you find yourself in such a situation that you are likely to fall. Also, you can attend a group therapy. Group therapy is very, very vital. In group therapy, you learn how other people have been able to struggle, how other people have been able to keep themselves out of stealing, how other people have done well with medication or with therapy. And you apply the same towards yourself, and you can also get it done. If someone else can get it done, you can also get it done. Now, prevention. Getting treatment as soon as compulsive stealing begins is key. Now, once the person has the urge to steal, and they begin to do it quickly, family should help get them treatment. If it is gotten early, it helps them prevent becoming worse, and it also prevents some negative consequences. like we talked about, being arrested, put in jail, or thrown out by family members, burning bridges. So this is very, very vital. Early intervention is very vital. Now, how people will call me and say, okay, how do I help myself? What do I need to do? I have this illness and I'm struggling. The need to help yourself is very paramount. How do you help yourself? Number one, stick to the treatment plan. Whatever treatment plan that your psychiatrist or your treating group have designed for you, stick to it. Take your medications as directed and attend scheduled therapy sessions. So if you have a therapist who says, come see me on Monday, please do the best you can to keep up with that appointment. Two, it's good to educate yourself about the illness. Once you learn about kleptomania, you become equipped. You know what it is, you know what it's about, and you can quickly stand against it. You can resist it, you can say no to it. You understand the risk factors, and you know the treatment, and you also know what triggers you to do it. Once you know what the triggers, you keep away from them. So, number three, is very, very paramount to identify your triggers. Identify the situations, identify the thoughts and the feelings that may be what triggers you to do this stealing. Once you identify these, they can help you. Now, if there are other problems like substance abuse or other mental health care problems, get treatment for those. Your substance use, depression, anxiety, stress can feed off each other with the kleptomania. And this will lead to a cycle of unhealthy behavior. Also, it's good to find healthy outlets. Explore healthy ways of channeling your urge to steal or shoplift. Some people can spend time going to the gym, they exercise, they take part in other recreational activities. As they do this, it helps them calm down and reduce the urge. Also, you must learn relaxation exercises. You must learn to relax and manage your stress. So stress management is very vital. You need to try such stress reduction techniques or things like meditation, yoga, or Tai Chi. This will help in relaxing the person, and they will be able to manage the zeal, the drive, the urge. It's also good to stay focused on your goal. Your goal is not to steal anymore. Your goal is to go to stores, buy what you want to buy, and not take anything that does not belong to you, and not steal anything that could get you in trouble. So you must stay motivated by keeping your recovery goals. So you must plan and know your recovery goals and have them in mind, and continue to remind yourself that this is where I want to be. I don't want to get in trouble. I don't want to take anything that does not belong to me. And once you do that, you can begin to work on the to repair the damages you've done in your relationship with family, with other people, with co-workers, in the stores. Some stores, before you know it, you are barred from coming into the store. You have restraining order, and they call the police and say, we don't want to see this guy here anymore because he is always stealing stuff. And you know, but yet many people will go back to that same store, and once you continue to go to that same store, you could get rearrested, you could get prosecuted. So what people do is to know how to manage themselves know how to relax and begin to work on themselves so that they don't go to that store. But even if they go, they don't steal anything. And once that happens, they can comfortably go into the store, buy what they want to buy, and get out. And they could become friends or pals with the people at the store. Now, how can a family help somebody? How can we help as family members? How can we help someone with kleptomania? Family members must understand the illness. We must understand the details about the illness, what it is all about, what is it that will make somebody to do that? Why would they do it? So we must have a good understanding of the illness. Number two, family members must understand the details of the treatment. What is the treatment plan? What is it that we as family members are expected to do when we are at home? How do we help this person? How do we support this person? You cannot support him unless you have a clear idea of what the person is going through. We must understand their problems and triggers, and we must also know how they've been told by their doctors or treating team to cope. What did your treating team tell you to do? How did they tell you to cope? The individual may forget, but once a family member attends the visit with him, at least once or twice, to see their doctor, that way you'll be able to know what exactly they are supposed to do, and you'll be able to help them stay focused on their goal. Also, we know that group therapy is very helpful. People with kleptomania may benefit from participating in self-help groups. And this could be based on the 12-step program. So if you're going through this problem and you know that this is your situation, you know that it's hard for you to resist those urges, you may find a group. And if there is no group specifically for kleptomania, you can also attend groups like Alcoholic Anonymous, AA, because it is the same process, it's the same procedure. People, you go through the same steps, and once you are able to follow the steps gradually, and you're able to resist the temptation, over time you can walk into a store, buy what you want to buy, and get out without committing yourself into stealing what you don't really need. That is kleptomania. We talked about the causes, we talked about the symptoms, we talked about the treatment, and also how to stay clean from it, how to do well. That is kleptomania. The difficulty with resisting the urge to steal, to take what does not belong to you. Well, thank you very much for tuning in today. I want to also thank again Dwight Ward, Waja, Prince Will, Tom, Ernestine, Joseph, and all other guys from Sweden, London. Thank you for tuning in. We'll see you again next week, Thursday, at 1 p.m. Eastern Standard Time. Thank you for tuning in today. We'll see you again, same time next week.